Hey y'all, we're going to talk about National Registry scenarios and items, which will be seen on our upcoming examinations. Let's get to it. Hello, my name is Paul Rosenberger. I am the Examinations Content Manager at National Registry, and I've been with National Registry for 1 year now. Prior to coming to Registry, I was a 911 paramedic in Texas, and then I was a flight paramedic in Alabama, and then I've been an EMS educator in Dallas, Texas for over 20 years. In the program in Dallas, I taught EMR, EMT, and paramedic courses, and I also taught initial and continuing education courses. My role is the project leadership. The content team is building these examinations by utilizing numerous SMEs, and these SMEs are at the AMT level and the paramedic level. And we're also getting input from an expert advisory panel as well. We're super excited about the project because this is going to improve our examinations and measure clinical judgment, which is clinical reasoning and decision making in a more authentic, with higher fidelity, and it's just going to be a better examination. Our current examination process encompasses a student finishing a course and the program director indicating that they have officially completed the course. They then make National Registry applications and pay fees. They then schedule an examination at the Pearson VUE Testing Center for the cognitive portion of the examination. And then they schedule a ALS psychomotor examination locally. And that's the process to become certified. The need for change, to change and measure psychomotor and clinical judgment really comes down to a recent paper that was published in the Prehospital Emergency Care journal in early 2022. This is a super great resource for defining clinical judgment in EMS. It's a must read for an EMS educator. But what the paper describes is all the components of clinical judgment: the en route phase, the on scene phase, and the post scene phase, and all those little steps and all those decisions that we make when we take care of a patient. The rationale for change came about because the public, our patients, our employers, and our clinicians in the field demanded more authentic testing and better public protection. If you remember, in January 1st of 2017, National Registry implemented the integrated out-of-hospital scenario testing, and this process really tried to get at testing higher order thinking constructs. The skills were captured in a portfolio. And despite all these changes that occurred in 2017, we still needed to make improvements to the examination. And so now the ALS redesign is the next natural step in that improvement journey. It is also our opportunity to utilize technology and innovation and make our examinations better. So you may be asking, what's all the excitement? What should we expect? Well, first of all, we're going to begin the piloting of the performance component in August of 2022. Our goal is to pilot items, capture metrics, review and refine those items and improve them. And the importance of this is that it's going to increase our reliability and our validity of our examinations. And most of all, we're going to have better fidelity. Our reality is going to be reproduced in a testing environment. The scenarios will be more authentic content, reflecting the knowledge and skill needed to be a competent practitioner. And finally, we will have contextual testing where we assess the knowledge, the skills, and abilities in the same context in which they're used in the field. And so that really allows us to use technology and really do good things with our examinations to identify those candidates who are competent and the candidates who are not competent. Okay, so we have arrived at the Pearson VUE Testing Center. We've signed into the computer and we've filled out a few NDA statements and we've done a brief tutorial on using the items. And so here we are. We're looking at our first performance examination item. On the left here, you're going to note that there's 3 tabs in the upper left. The first tab that is lit up right now is the en route. The second one is the scene, and the third is the post-scene. Another thing to point out on this screen is that you'll notice that the scenario is on the left side of the screen, and the item itself is found on the right side. And so as a candidate answers these items, the screen on the left is going to stay the same until they move to the next phase, and the items will just change on the right, one by one. And so with that said, we're just going to kind of work through the items here. So here's the scenario on the left. And on the right, we have an item that says to identify the dispatch information queues that the AMT should prioritize for response and scene readiness. And it asks us to select 2 answer options. So for this case, the information that is relevant is the fact that the patient has agitation and it's raining outside. I will then hit next. If I don't have 2 answers selected, it will not allow me to advance the question. I've now advanced to a second question, and on the left, the scenario remained the same. On the right is the item, and in this case here, it's asking about leadership. And so the question is what kind of items down below is indicating leadership for this case? And the answer would be to assign responsibilities to the crew. Again, if I don't select an answer, it will not let me advance. So you can see now that the scene phase has lit up and the scenario is a little bit more involved. It now involves information about the patient's medical history, how we find the patient, and some assessment findings. And on the right, we now have a new question. And if you look at the 2 tabs, you'll note that the tab on the left, the scene is lit up. And at the top of the question, it says scene. And so we now know that we're answering a question for the scene. So which of the following findings are most significant in determining the nature of illness? And we have 2 answer options. And this patient is a diabetic, and they take diabetic medications. And they are also having an altered mental status. And again, I select 2 and hit advance or next. Based on the patient observations, which of the following conditions could explain the patient's current state? We would know that this patient's taken too much insulin and has been fasting, and that would explain their low blood sugar. And then finally, the third question here is, which of the following initial signs and symptoms are consistent with hypoglycemia? The only correct answer here is altered mental status. And so one other feature I want to show about this is that I can move backwards in the scenario if I want to sort of see what happened en route in case I forgot. I can also bounce to the scene, but at this point, because I haven't answered all the scene questions, I can't go to that post-scene phase. So I have to answer this question to move to that third phase. And so the question here is, what would we do for this diabetic patient? We're going to start an IV and give dextrose, hit next, and now we're at that post-scene phase. And what you'll see here is that I can go back to the scene and see what I saw on the scene. I can also go back to that en route phase to answer my questions. So here, the scenario has changed. We're now post-scene. We're en route with this patient. And it asks, because of the observed patient changes, which of the following actions would be beneficial? And so what has happened here is we've given sugar. It only came up a little bit. And so our next action would be, this patient now is vomiting, so we want to obtain suction equipment. And then finally, it asks further therapy for this patient because the first round of dextrose didn't work. What are some options that we could do afterwards? And so we would consider more dextrose and some glucagon. Hit next. And then what are some other medications that we could consider for this patient? Because this patient is vomiting, we could consider some ondansetron. So you may be asking now, how many scenarios and items will I see? For the AMT, we know that you're going to see at least one scenario and that scenario could have anywhere from 9 to 18 items. For the paramedic, you'll see more than one scenario, but you're going to see fewer items. And again, you're going to see probably 9 to 10 items on the scenario test for the paramedic level. Thank you for watching our video. This is an exciting time for National Registry and EMS. Continue to watch our website and our social media sites so that you can gain valuable information of the changes that are coming forward. Again, thank you for your time. We're really excited that you spent a few minutes with us.